Okay, so we're gonna do the nose, mouth, and oropharynx. So first, I'll just have you face me, and you're just going to look. We'll start with the nose. You're just going to look at the nose externally, looking for any deviations that could indicate like if they broke their nose in the past, or any nasal flaring, which indicates respiratory distress. And then I'll use my otoscope with the tip cut down. Use like 50% of the light, and you focus it into about an inch on my hand, which I did before I started the video. Then, don't be scared. You're gonna tip their head back and support their head. You're going to slightly pull up on the tip of their nose and place it in. And then you were observing the turbinates and the mucosa. It should be a nice pink coral color. If it's red, that indicates a bacterial infection. If it's a white or pale, that indicates like a viral infection or just allergies. And also looking to see if there's any discharge too. A clear discharge is just allergies or a viral infection, and a pussy yellow-green discharge is a bacterial infection. Okay, and so then we'll move on to the mouth and oropharynx. So first, you're just going to observe again, looking at the lips for color, moisture, any lumps, ulcers, any signs of like herpes 1, cold sores, anything like that. And then you're going to have gloves on. You're going to take a piece of gauze. You're going to have them stick out their tongue, and you're just going to lightly grab it and move it around, feeling for any restriction. You're also going to look at the tongue and look under the tongue, looking at the frenulum, the bottom of the mouth, anything like that. While you're doing this too, you're observing for any abnormal amounts of saliva, whether it's not a lot of saliva or too much saliva. You're looking at all the mucus, looking at the colorings. Then you're going to take a tongue depressor. You're going to use the light. Then using the tongue depressor, you're going to have them open their mouth. You're just going to look at the cheeks, the gums, looking in between the teeth, also noting like any discoloration of either the gums or the cheeks or the teeth. Looking at both sides, looking at the floor of the mouth for any bumps that could indicate like a blocked salivary duct. Looking at the roof of the mouth, the hard and soft palates. Okay, and then I'll have you stick your tongue out. Say ah, looking at the uvula, the tonsils, looking for any deviation of the uvula, which could indicate like cranial nerve problems. And then, so for then testing, I will have the patient, can you plug one nostril and breathe in and out fine? And then the other side. And then again, we'll do the sinuses with this one, so I'm just going to press on your sinuses. Let me know if there's any pain with any of this. Doing the frontal sinus, going down the bridge of the nose a little bit, and then the maxillary sinus. And then we will also percuss, so you'll place your fingers. Let me know if there's any pain, and just tapping on your fingers across the sinus. If there's pain, that would indicate sinusitis, the inflammation of the sinuses. And then I would also do that across the maxillary ones. Then cranial nerve assessment. So for cranial nerve 7, or 12, I mean, I'll have you stick your tongue out and you look for any deviation side to side. And then cranial nerve 9 and 10 would be the gag reflex, which my patient doesn't want to have that done, so I'll just explain it. So what you do is you would have them stick their tongue out, say ah, or just stick their tongue out. You'll take a tongue depressor and you'll just hover over their tongue and you'll put it farther into their mouth until you see the uvula react. So you don't have to fully make your patient gag, just a slight reaction is enough. So don't make your patient throw up in your office or anything. And then while I'm doing all of that, along with the inspection of saliva with it, you're also going to assess for any halitosis, which just bad breath in general doesn't necessarily mean there's anything wrong, but if there's like a sweet breath, that could indicate, especially if they're diabetic, that there's a glucose issue in their blood.